Hello and welcome. I'm Dr. Carl Gold, and I'm here in the mountains of Utah at Hidden Peak to demonstrate something really exciting for the practice of wilderness medicine. So we have an injured patient on the mountainside. I'm the wilderness practitioner. I show up at the scene, I get my medical pack out, and what I need right now is an ultrasound of this patient's abdomen. So what I do is I have my wireless ultrasound probe. I have high frequency linear, low frequency convex, and cardiac imaging all in one probe. I simply take my iPad out where we can obtain our images at the scene. I open up an app, at which point I would begin imaging the patient for free fluid, ligamentous musculoskeletal issues, fractures, any other medical condition that might be ascertainable by ultrasound. I can do that immediately here at the patient's side, on the trail, on the mountainside, on the water, and then I can transmit wirelessly from the iPad to the medical base waiting to receive this patient. They'll have all the images ready to go, and they'll be able to get the diagnosis here at the patient's side, and the patient care is now elevated and more efficient and safer from the trail to the medical base.
Next, we'll have a look at Dr. Gold performing an exam on a physician's shoulder. Notice the speed and the flexibility of the app and the detail in the images.
Far side over here on the left, there's a hypoechoic area.
Yeah,
So during workouts or something, you do have a little fluid, it's a little strain.
I know.
So you got a little shoulder strain. So that's I can tell that you've got a hypoechoic fluid collection. So you've done something recently to cause that to be irritated. That's the anterior shoulder look. Now we're scanning the proximal humerus. On the left side of the image, I'm bringing into view the subscapularis attachment. And in the middle of the screen is the bicipital groove with the cross section of the long head of the biceps. So we think this can quickly and easily demonstrate the value of this probe in all MSK assessments, rehab, needle placements, et cetera, but this is an excellent view of the proximal humerus.
And here we have the same E8200 that Dr. Gold was holding. It's dual-headed, so you can image with the linear on the bottom or the convex or cardiac at the top, using an ultra-fast, cyber-secure connection built right into the scanner. And using our fast and friendly ultrasound app, you'll have the amazing image quality and features of the higher-end systems, and also take advantage of our unique features that allow you to perform your post-processing during the exam or later on. Anytime, anywhere, with enough battery for over 3 hours of active scanning. And unlike most other handhelds, there's never any overheating. Perfect for both the ER hospital or clinic, in the field, remote or austere environments, rain or snow, on a mountainside, trail, or even in the desert. And if you need more than 3 hours of scanning, you can easily recharge it with a battery pack, vehicle, or even solar. And it's more than a handheld. It's built for use in almost every specialty. With our unique interface, you can add an unlimited number of your own custom exam types with presets at the tap of an icon, even during imaging. Another feature of our unique workflow. Now let's take a look at a few images. First, here's an injection with our needle enhancement. Next is a gallbladder, where it's easy to visualize the stones. And 2 different views of a kidney. And a renal cyst. And how about our split screen, where we're also adding measurements, annotations, and commentary, safely and securely using our ultrasound app. And even confirm an intrauterine pregnancy, and to assess the developing fetus. And when it comes to cardiac imaging, notice the level of detail even while in motion.
Our probes are also helpful for vascular imaging. We are able to do central vascular imaging as well as peripheral vascular imaging for vascular access procedures and or any other diagnostic approach. Here you can clearly see the carotid artery in the center of the screen and the associated internal jugular vein. They're getting bigger and smaller as I speak and breathe. To determine the presence or absence of a blood vessel, we would use our color Doppler feature. I can move the window and size it. This defines the carotid artery and the internal jugular vein.
If you'll be attending the Wilderness Medicine Conference at the Big Sky Resort in Montana, be sure to stop by our booth. And if you'd like to learn even more, our scanners will be used in the hands-on workshop, Ultrasound Skills for Wilderness and Austere Environments, on Monday, February 23rd from noon to 4 p.m. It's not easy to develop technology like this. But just like the transformation that downsized mainframes into tablets and cell phones, we've revolutionized ultrasound, making it faster, easier, and more convenient at a dramatically lower cost. And we also provide our own training and support without hidden charges or a subscription. So send us an email or a text, give us a phone call, or fill out the form on our website and find out what the best kind of magic is all about. Thanks for watching. See you soon.